Rockford 911, what's the address of the emergency?
You call 911 because you have an emergency. We show up and we take you to the hospital. And so what we've seen over the past 10 years is a steady increase in call volume. If calls continue to rise, and that's not unique to the city of Rockford, that's a nationwide issue that everybody's dealing with. If calls continue to rise, maybe we're not thinking about this accurately. At some point in the history of the fire service, somebody said, if only we knew that fires were happening. And so they implemented a fire watch, and that turned into, oh, but we can identify when there's smoke in a room. And so now we have things that detect smoke, and then now we've got sprinkler systems. And so on the fire prevention side, it's definitely evolved over the years, and we've seen the impact that that's had. Is there a way to get into EMS prevention? What is the mechanism that's going to say, hey, I smell smoke here. This person has been utilizing the 911 system. We've taken them to the hospital X amount of times. It doesn't seem like that's working for them. Is what we're doing sustainable? Are there other ways to think about it?
The systems in place to respond with lights and sirens were built decades ago for a certain kind of problems. The problem is different today. An individual may be utilizing our services often for diabetes, but it turns out their diabetes wasn't the main issue. They didn't have food security, and they didn't have food security because they had lost their job, and that way they couldn't pay their bills, and their refrigerator wasn't working, and the fridge wasn't working because they couldn't pay that electric bill, and they couldn't pay that electric bill because they weren't able to get on benefits, and they weren't able to get on benefits because they didn't have a license, they didn't have a social security card. With MIH, it's a way to reimagine the fire service. Instead of just going to the hospital, instead of just only focusing on diabetes, we focused on the individual, the human. We started this idea of showing up to where the patient was at.
We had one patient who we were referred to her because of medication. She wasn't taking her medication. When we arrived at the residence where she was living, we found financial exploitation. We found that there was other possible abuse mentally. We found unsafe living conditions, and we had to address those first before we could address what we initially were called for.
Not every single patient is the same, and so how we respond to individuals will be the right clinician at the right time with the right resource.
We would meet her at her cousin's, and then it got to be where it was not a safe environment. And so what we would do is that we would go and pick her up, and we go drive around, or we go to the park, or we would go and get coffee.
And that was our visit. And she was comfortable with that because she was out of the environment that caused her so much stress, and she could open up more, have a chance to hope, that things could look different. Just having people able to pick her up and take her somewhere for a second.
You could be a low socioeconomic individual, or you could be somebody with every resource in the world that still is unable to navigate the healthcare system. We're gonna find a way to help you with the gaps in the system or in the community differently than maybe your doctor or your primary care physician. And the way we can do that is the ecosystem of partnerships that we've formed here in not only Rockford, but the Winnebago County area.
Through some time and a lot of different visits and interventions and things that other agencies kind of co-helped us with.
Yeah, we didn't do this all alone.
We had so much help from like Stepping Stones, Rosecrans, the hospital. We worked with a ton of people that helped us.
I think about the entire communities investing in this service. We're really fortunate at the fire department to have great partners with the Winnebago County Mental Health Board. And why it's so critical that we're all investing in this together is because our residents need it. We are strongest when our residents are being served. And we are strongest when our residents are being served where they're at, when they're in their time of great need.
Now she shows up for our visit. She's got her hair done. She's laughing at stuff. She's smiling.
She's engaging.
She's planning where she's going to put this furniture and that furniture in her apartment. So we're super, super excited about that.
We're very happy.
We started with 12 patients, with one person going out and meeting with them about their chronic medical conditions. Today we see individuals for mental health and substance use disorders. We see veterans, we see unhoused individuals. We have a respite program. We see us now going from 12 individuals in encounters to over 4,000 encounters this year with over 700 unique patients. We're finally starting to see, for the first time ever, a decline in our EMS call volume, and I think that's only the beginning.
I just feel very fortunate now to be in the position where we are moving the needle. What started out 10 years ago as something innovative, and will it work, will it not work? We're now seeing the fruits of that labor. Because of the people who've come before us, we have a tremendous amount of responsibility to be able to continue this good work forward. We are implementing what we're going to call the Division of Community Risk Reduction. What if we said, hey, we're going to have fire prevention and EMS prevention all under one umbrella? We're still going to be doing the fire side with inspections, investigations, and public education, but now we're going to be on the EMS side doing public education, community outreach, working with individuals with their chronic disease and mental health, and getting them connected with a mobile integrated health manager. And we're taking a very 30,000-foot view at how do we decrease and minimize the risk for the citizens of Rockford.
We're building something differently here because we want different results. And I hope that this model and how we continue to expand and grow will be not only a model that is well respected, but I want it to be the gold standard.
We could not have the mobile integrated health program that we have today without the Winnebago County Community Mental Health Board. And so where we started something that seemed innovative 10 years ago, and what we've grown to be something that's just part of our culture and the infrastructure of the Rockford Fire Department, we're now like in this position to be just the industry leader in how this operates in communities across the country. And that's just not what the fire department's done, that's what the board's done as well.
Help us help you in this community be the model the rest of the country looks up to. This is what showing up looks like. This is what the program does every day for anyone who needs it.